I want to introduce Susan Green, editor of the Colorado Independent, and Nikki Turner, editor of the Rio Grande Herald, and both of them are the proud winners of the Carolyn C. Mattingly Award for Mental Health Reporting. So I'd like to start by congratulating both of you on an excellent story. I'd also like to introduce Dr. Paul Mackey from Minnesota State University, who is a former police officer himself, as well as an expert in mental health. He will be briefing shortly. We're going to open up first. I see more people still pouring into the call, so I'm going to wait just another minute for people to join, and then we're going to open up with Susan. Okay, it looks like we've got a lot of people on now. So first of all, thank you so much for being here. Congratulations on the Mattingly Award, very much deserved. I'm really delighted to be hosting this session. I want to start with a tough question, and then we'll segue into an easier question. My tough question is this. In 2016, we heard a lot about what was going on in flyover country, which is a really ugly term, but one that we ignore at our peril. But the truth is that the COVID-19 infection rates have actually been relatively low to date in rural America. So I think there is a risk that what's happening in rural health and rural mental health out in rural America will once again be overlooked and not get the attention it deserves, which is one reason I think it's so important to have our journalist friends here writing about this issue. So the first question I have for you, Susan, is, why should America care?
Well, these are the people that produce your produce. These are the people who grow and process your meat. We may have, low infection rates throughout the country in rural America, but there are certainly hotspots, including meat processing plants. We have some in Colorado and also other food processing plants. So just from a basic sort of humanitarian level, we might care because this is not just really about infection. This is also about the aftermath and the repercussions economically and financially. In Colorado, we're actually known as a fairly prosperous state, but we have wide swaths of our state that are at the very, very bottom of the country in terms of economic standing, and really huge rates of addiction, especially methamphetamine, and really ridiculously, almost obscenely low levels of care from addiction counselors, social workers, psychiatrists, psychologists, and as our story reported, almost no training from the police, who are often the first responders when people have mental health crises. I also think, you said we ignored rural America in 2016 to our peril. And there are many, many people in rural areas, and I think Nikki can speak to this better than I can because she lives in one and I live in Denver, who just really don't believe that this is a big deal, and feel very much about these governors who have put in place, sorry about that, what they believe are draconian measures to shelter in place, and just are getting kind of sick of it. And so we are in an election year, and I think there's a lot of frustration and unrest, and really, I want to say, because I was in rural Colorado this weekend doing some interviews, antagonism. There's really sort of, if there was a divide before this happened, now there's like this weird physical kind of like, ooh, you city people have cooties, don't come near me kind of thing, or you people are ruining our lives, or you're ruining our business. And so this stuff is not just ideological anymore. It's like physical and financial and very, very real. And I think it would be beyond to our peril to ignore what's going on in rural America right now.
Okay, well, let's turn to your story, which is called Through the Cracks, which is, I thought, a wonderful headline because the protagonist fell through the cracks on so many different levels. Can you tell us what first of all, what your tips are for reporters about how you got this story, and what should reporters take away about how they can do a great job reporting in this space?
Sure. So this was really Nikki's story. She was visiting, she lives about 6 hours away. We're both members of the Colorado Press Association. She was in town for a meeting. We were having beers in our backyard, and I asked her, what story do you want to cover that you need help with? And there had been, the police had killed in a small town near her called Rangeley, which she covers, a man 6 months prior, and she was getting completely stonewalled on what had happened to that man, and also really what happened to the police officers who killed them. This is a 3-person police force, and so 2/3 of them, the chief and the lieutenant, had been put on sort of suspension and then essentially fired, but without any announcement or any really public information about like who's protecting the town kind of thing. And I just want to say, because Nikki texted this to me earlier, the town manager proclaimed, what day is it today, Nikki?
No, it was Friday. It was Friday.
Which was what?
National Mental Health Month.
Yeah, National Mental Health Month, and the town manager, social media or announced or did a proclamation that it's National Mental Health Month. And this is a woman who, you would do these interviews with her and there would be no recognition that the man they killed had paranoid schizophrenia, that he was in an acute crisis. When she used words around mental health, she would say things like, when I would ask her, she would answer, yeah, he was mental, or just like really just clueless about the language of mental health and the prevalence of problems in her community. And so what I would advise is to fight like hell for public records. I would advise to fight like hell to speak to the people. When police kill people, it's typical that reporters can't reach them. That it's instantly lawyered up, and there's really sort of like they circle the wagons, let's say, and so they keep any information from the public. And so, and I've fallen guilty to this too, because I've covered a lot of police killings. You kind of sort of assume you're never going to get to them, or if you get to them, they're never going to talk. Well, what really made this story was that the man who killed Daniel Pierce turned out to be the police lieutenant who killed him, probably the person in town who knew him the best, and certainly the only person in town who knew he was in an acute mental health crisis. He found out a couple days earlier, and also completely traumatized by the killing. And he actually had a gag order, and his wife had a gag order. And despite those gag orders, he spoke and really wanted the story out, not necessarily so it made him look good or justified in killing Daniel Pierce, but that it sort of illuminated what had happened. How did this man die? How did the police force lose 2/3 of its personnel, including the chief? And I guess I would just say, don't give up, and don't assume that people are not going to talk, because sometimes they do. And because he did, I think that really made our story.
Thank you so much. You wrote a very telling sentence, the two of you, where you said, you found the killing of Daniel Pierce may have been legally justified, but it was not unavoidable. I found that very moving and powerful, because we always second guess, and yet we don't really do enough to think about what went wrong often in these cases.
Yeah.
Tell us about that.
Well, first I want to say, about the term legally justified. It pretty much always happens. I can't really think of a police killing in Colorado in the last couple decades that has not been found legally justified. And, there is a lot to talk about, not on this phone call, but to discuss about why it always happens that these these incidents are always legally justified, right? But in this case, Mr. Pierce had really led police on a chase, and he was ignoring repeated, and when I say repeated, I mean dozens of pleas over the loudspeaker to pull over as they were chasing him, and really put them in a tough spot. And I want to say this. It was a completely avoidable spot because they did not have to chase him the way that they did. They could have let him drive to another county. They could have done many things to de-escalate, and actually the police escalated. So I don't want to excuse the fact that they killed a mentally ill man here. But when I say it was not unavoidable, I mean, we have a videotape, it's linked to in the story, of an encounter with between Mr. Pierce and Roy Kinney, the lieutenant, where, you know, he's saying he's Jesus, and he's saying he's threatening the town, and he's completely decompensated. And what should have happened per protocol is that the police officers should have been able to call the mental health sort of regional provider in the area and get some help for him, right? So he didn't become the first line responder when this blew up. And what happened is he called, but he didn't ask for help. He called in a sort of really rote way to sort of justify, okay, I'm not putting what's called an M1 hold or a mental health hold on him. And the phone call actually lasted 30-something seconds. So he was making contact with mental health professionals, but that mental health professional didn't say, we need to get there and help. And he also didn't say, please come and help this man. And in the most flagrant way, that's how it was completely avoidable.
Thank you so much. So Nikki, let me turn to you for a minute. You wrote about Rangeley, population 2,300, and you said that residents were twice as likely as the average Coloradan to be uninsured, far less than half the mental health providers per capita than the state average. The whole county, 2 licensed professional counselors, 2 clinical social workers, 1 registered psychotherapist, no psychologists, no nurses specializing in mental health. Has anything changed since the publication of this series and the attention that this work has drawn to this unbelievable gap?
There have been some baby steps going forward. The local psychiatric hospital that we have is 100 miles away. So it's a 2-hour drive one way, and they have expanded. There seems to be more communication, just like, you know, I've lived in this area now for 20 years, and I never remember seeing the town manager proclaim anything about mental health. And so for that to happen on Friday, I was like, okay, maybe we made a difference here, and we're able to bring to light some of these issues. It's an area where, you know, you were talking about flyover country. Our area was economically depressed and disadvantaged prior to COVID-19 happening. We have a lot of oil and gas that's gone by the wayside or is going by the wayside. And there's a lot of fear and a lot of concern. And when you tie all of those things in to a lack of mental health resources, it creates a problem. It really does create a problem.
Okay, turning to the journalism for just a minute before we go on to the rural mental health issue. So you kind of define grit. You got shut down, you got threatened, you got told basically, we're not going to talk and you have no right to these records, and you didn't give up. So I'd like to, first of all, salute you. And second, salute the fact that there are many people in rural journalism right now whose lives, livelihoods, and newspapers and news outlets are going under as we speak due to lack of advertising. So first of all, congratulations. I'm glad you're getting the recognition you deserve. What advice do you have to the beleaguered editors, publishers, reporters, online news providers in news deserts and in beleaguered communities like yourself during this crisis?
I would say there are people, your readers, your subscribers, the people who partake of your news, they want these stories, they need these stories. And it's important for us to go and get them no matter what it takes. This story needed to be told for so many reasons, for Daniel Pierce, for Roy Kinney, for the town, for our entire county and community to be aware of what had happened and what had gone on. There was just a blank spot in this huge news story that had occurred in our county, and just go after it and ask for help. I mean, we would not have been able to, I would not have been able to do this without help. I didn't have the skill set or the resources to be able to track this down and do this. So ask for help. I think in journalism, I think we're moving towards more collaboration all the time. We're going to have to work together.
Thank you so much. For those who are joining the call late, I saw a bunch of people come in just now. We're on the line here with Susan Green and Nikki Turner. If you want to ask a question, you can either put your question in the Q&A and we'll get to them shortly. You can also raise your Zoom hand. And there's a green button that you should be able to see. If you see, I see one hand raised. If you see, if you can't find your button, look around. And if you want to raise your hand, we'll get to you as soon as possible. Nikki, assuming that there were, mental health resources available in the town, and now that there's more of a, at least more of an opening to realizing that might be needed, there's still this issue of stigmatization in, and not just in rural America. I by no means want to suggest that that's just a rural problem, but in America, we're finding everywhere that fear of being stigmatized is a major reason why people don't access service, but it may be even more acute in rural areas. What's your observation and reporting on that?
I think it's definitely more acute in rural areas because you're in such a small community. Your mental health provider is somebody that you're going to run into at the grocery store or the post office. And so that can create some discomfort. There are some concerns about, did somebody see me going in for my appointment? We actually rented space in our building in the last 6 months to a part-time counselor, and she was having people come in the back door and liked having that privacy aspect of it, because then people could come and see her for an appointment without anybody really knowing what they were here for. So yeah, there is definitely a stigma issue nationwide, probably worldwide. The more we talk about it, the more transparent we are about it, the more everyone who can speak about it does so. I think that helps reduce that stigma.
Okay. And before we take questions, I want to come back to just one last question about Through the Cracks, which is the title of your wonderful two-part series. By any normal measure, Pierce fell through the cracks on so many multiple levels. His younger brother was murdered. His father died of a heroin overdose. He washed out of the army under, strange circumstances. He had opioid addiction and apparently a lot of chronic pain before that. He had called a SWAT team on his wife. So he had flashed on the radar of mental health and other authorities for most of his life. Mm-hmm. So in a way, it's kind of unfair that your town, ended up being the flashpoint for dealing with somebody whose mental health problems had been neglected by many, many other jurisdictions. What do you think happened that he never really connected, despite all these brushes and frankly the fact that he was committed at one point?
There's two things that stick out to me. One is the fact that he was not exhibiting the symptoms of paranoid schizophrenia until he was prescribed a medication that is known to have that as a side effect, and was left on that medication following a car accident for a ridiculously long time, even after he began showing symptoms. So that was one of the things in the story to me that was just shocking and appalling, that there was such a disconnect between his medical providers trying to deal with his pain and yet ignoring the mental health side. And then the other thing that stuck out to me was his estranged wife talked about how difficult it was for her living with him, how he would talk his way out of situations. He would talk his way out of taking his medication. He played the game. He knew what he was doing, and was able to talk his way out of getting the treatment that he needed. And I mean, that's so difficult. I don't know anybody that's had mental health issues in their family or in their life that hasn't dealt with that, had addiction problems in their family, and had to work with people who, they talk their way out of the system. They talk their way out and nobody can stop them. How do you stop them in a free country? I mean, that was one of the things that was discussed with the police officers is, well, we don't just want to put him in an M1 hold, because if we do, we're taking away his rights. We can't just hold him and take away his freedom and his independence. And so it raised so many questions for me. There was such a ripple effect of all of these situations that Daniel Pierce had in his life, and it just kept rippling, and the ripples got larger and affected more and more people, and affected more and more people on a mental health aspect. You end up with his wife dealing with things, you end up with the officers dealing with mental health issues afterward. It's a tough subject.
Okay, thank you. We're going to go to Dr. Mackey in just a minute, but first we have a hand raised. Juliet Beverly of brainfacts.org from the Society for Neuroscience. Juliet, can you
Hi.
hear us?
Yes, I can. This question might be answered by Paul Mackey, but what are some critical mental health disparities that should always be contextualized regarding rural communities when we're reporting on COVID-19 cases?
Well, thank you for the question. Just to help clarify, in what reference are you thinking?
A lot of folks are diving into COVID-19 stories, and they might be unfamiliar with issues happening in rural communities. And some of that might require further context. So are there some key elements that folks should be aware of if they are not from that community or not familiar with that area?
Okay, Juliet, actually we have a whole presentation. Dr. Mackey has a whole presentation on that. Why don't we turn to that first, and then we can take any further questions after that. Paul, you able to?
Yeah, I think that something that Susan has talked about, Nikki as well, briefly, is the fact that an awful lot of meat, produce, and agriculture, of course, happens. The processing happens, and understanding some of the, or trying to understand some of the elements around that. But another big issue is just the overall lack of access to behavioral health care. If somebody's feeling like they need access or they want to access, that, too often just being able to find that resource is much more challenging in a rural area, which suggests that it may be longer for somebody before they reach out and ask for help. It's too often, especially among the most rural areas, the resources, they may actually exist in one capacity or another through a county or through a social service agency, but people don't know how to access them. Thank you for inviting me. I'm here as professor of social work at Minnesota State University, and I'm also a longtime member of the National Association of Rural Mental Health. And it was through NARM that I was asked to participate in this. And so in about 10 minutes, let's see what we can cover regarding kind of what we know, if you will, around rural mental health, and try to make some connections to COVID-19. So starting with considering this a catalyst for change, if you will. As you've learned through Nikki and Susan's stories, that the COVID-19 has, in many respects, kind of exposed the challenges here. Some will argue, probably quite rightfully so, that the pandemic is going to make things worse, and in the sense of accessing, and yet it can also be a catalyst for change. And I think that it's important to keep in mind that many Americans, perhaps most, who are receiving behavioral health services that are traditionally used to receiving face-to-face, that option was taken away basically from the results of the pandemic. So regardless of where you are, we're using telemental health services now more than ever to deliver treatment. So just a little background, rural residents are older, they're more likely to lack computer literacy, they have less access to services. We know these things, but another thing to keep in mind is that they are much more dependent on primary care physicians and law enforcement to identify and treat. I mean, the physicians will be doing the treating, law enforcement for identifying, but rural areas are much more dependent on those populations for providing service. Between 15 and 20% of the total U.S. population is rural. It depends on how you count it. There are multiple ways to count, but we're talking 15 to 20% is always safe. I put in the higher education, rural at 18.5% for bachelor's degree or higher, compared to urban to 32%. And the reason why I think this is an important thing to identify is that behavioral health practitioners, by and large, are going to require advanced education. Be they social workers, psychiatrists, psychologists, any form of service. And I think it's important to remember that in rural areas, we tend to have lower education attainment, and that creates a pipeline problem, if you will, that rural have smaller populations with lower higher education attainment, that at the end of that pipeline, when you're looking for the clinical social worker or the counselor or the provider, that too often they're just not there. And the state and federal responses that we currently are that we have available typically do not fully respond to these barriers in supporting education, supporting professional development, continuing education. So a lot of the work that I've done over the years has really hinged on workforce education and preparation. So I have 4 critical issues. 60% of rural Americans live in a mental health shortage area as defined as such. So going back to some of the critical issues, the lack of broadband technology, and also identifying that, in fact, sometimes when what we read or what gets reported is that broadband does exist, but that it focuses on specific areas and is not really widely spread. So it goes to hospitals or schools or courthouses, but it doesn't actually reach out to the rural homes. And then, of course, there's another issue that does need to be discussed, at least briefly, is the overall lack of literacy to utilize and really be able to maximize the value of the technology when it does exist. This is not a new problem. As early as 1987, we've talked about this. There's been published research even before that. But with COVID-19, we're now becoming very quickly aware of the digital divide, as we like to call it, and the gaps in access in rural. So Tyler, if we could advance the slide. So some of the limitations that I believe merit further discussion are going to focus around licensing. Currently, if someone's licensed in one place, they may not or typically won't be able to practice in another because state governments control licensure, and that's important and it's good. But often a question will come up and say, but I'm in Nebraska or I'm in, doesn't matter, I guess, New York City, I suppose, wanting to practice someplace else because the technology doesn't know the state boundary. Well, the licensing does. And so that's an area that we can have conversations or should have conversations about and trying to create more seamless transfer. And then the need for comprehensive public service, which this speaks to Nikki and Susan's story that we understand, and we've understand for a very long time, that police and law enforcement are often de facto mental health responders in rural areas. The Department of Justice has a clearinghouse for law enforcement to be able to better respond. And we have initiatives, things like the Stepping Up, that focus on reducing incarceration of individuals with behavioral health problems and concerns, so that they're not being unfairly and wrongly diverted to the law enforcement area and instead being referred to appropriate treatment and care. So put together these recommendations, the idea of developing a comprehensive community response. This would include law enforcement and EMS and medical. And I'll be very honest with you, I think that to be truly comprehensive, it has to include all facets of a community. Revise licensing or look to opportunities to be able to allow freedom of practice to be able to cross state line and at the same time respect the state rights. Treat rural broadband as a second tech grid. This is something that I feel is very important. In 1936, we passed the Rural Electrification Act to essentially electrify and provide services across all of the United States. We did not do that in any kind of real, truly comprehensive way with broadband, and I believe that is a second tech grid response. Expanding first responder training and preparation for being able to respond to behavioral mental health. There are trainings already available. There is already a push for that, but clearly we need to do more. And integrate use of teletechnology into practitioner training so that we are preparing practitioners and to be able to go out into the communities and have a much better knowledge and frankly a higher level of comfort in responding to behavioral health.
I want to take a couple of questions that are online. For those of you who want to ask questions, raise your Zoom hand. One interesting question from Minnesota, from Sue, from Nancy Fitzsimmons, mentions that the executive director of the National Association for Mental Illness says we should stop using the term stigma. Rather, we should call it what it is: prejudice and discrimination. Stigma keeps people in the closet. Prejudice and discrimination means this is not a private trouble, but a public issue, which I think is the point of Nikki and Susan's reporting. This is a civil rights issue, a human rights issue. Dr. Mackey, you want to speak to that for a moment?
I do apologize. Could you repeat the question? I was having some.
Oh, sure. The question is that the comment is that we should stop using the term stigma, which keeps people in the closet, and we should start calling this what it is, which is prejudice and discrimination, that we should recognize it not as a private trouble, but as a public issue, a civil rights issue, and a human rights issue.
I couldn't agree with my colleague more. The term stigma is very commonly used, and everyone knows or thinks they know what that means. But I fully agree. This notion of understanding that what we're really talking about is prejudice, discrimination, and owning that.
Okay, we have a question from Montana Public Radio, Ed O'Brien.
On Friday, I covered a candidate forum regarding mental health issues that we're all facing right now. And all of them were touting telemedicine as a terrific solution, as a primary solution for this. But the audio and the video was constantly crashing out, and I wanted to use an example of that, some sound of that in my story to talk about the limitations. And my editor, and I think he wisely said, let's not, because we don't know if they use a different technology for that. So my question is, do telemedicine solutions use different, more robust platforms than like a Zoom or a Skype? Does that make any sense? I was kind of rambling there.
Dr. Mackey, do you want to take that one?
Well, you know, I'm not an expert on the different types of technology. What I do know, though, is that there are some minimum bandwidth needs and expectations, and so you know, the challenges. Actually, Sonny and I were talking about this last week. That in the past we talked about low width versus high width bandwidth speeds, and today. The access to fast enough is better than ever, but still we find challenges, and we find them in more in rural areas. So it's hard to answer that because I'm not altogether sure. I know that there are different types. One has to always keep in mind that there are certain protections that have to be adhered to. So you know, with data privacy rights. So I think that you will still find, at least I know that you will still find different band speeds going on in rural areas.
I'd like to follow up with a question on the privacy issues that you just raised. In your slide, you mentioned that just because a community, quote unquote, has broadband doesn't mean people have it in their homes. They might have it at the library or the hospital or the police station. But for mental health treatment, obviously people need a private connection. Do you see that as an issue?
Well, from what I hear from rural communities and from tech providers, that they are finding ways and have found ways to be able to provide the privacy and the data protections necessary. So I sometimes think that the bigger challenge around that can be helping the user understand that the technology is safe.
Okay, thank you. Okay, we have a question coming in the chat from the Arizona Republic, Deborah Kroll. How would you say tribal communities are dealing with mental health issues, and what would you suggest to improve delivery of mental health services to Native peoples?
Is that, not sure, is that from,
I think that's for you, Dr. Mackey.
okay. Well, we do know that to varying degrees, that different communities have different levels of access. That we know that within tribal communities, especially remote areas, it may be much lower, the access. And as a result, they're not going to have the same level of access. But keep in mind that, well, it's not always the case. Some communities run their own behavioral health and their own healthcare systems, whereas others use the Indian Health Service and go through that. Now at that moment, you're talking about a federal delivery system as opposed to perhaps a state or an individual. So I think that is still clearly going to be a large issue. It's significant and needs to be addressed as well.
Okay, thank you. All right, anybody who wants to ask a Zoom question, please feel free to raise your hand. I'd like to flag that Susan and Nikki, as story doctors extraordinaire and editors in their own right, will also take questions from reporters about reporting issues and what they learned as a result of their expose and their very long, it was almost a year, is it, that you were reporting to try to really, how long did it take you to break this story open?
3 months.
3 months, sorry. So we'll take questions on that, but also questions on any kind of mental health issues. Okay. One thing I think was interesting that you talked about, Nikki, was in the story was that there was the police force was in the process of revising their guidelines in the middle of this.
Mm-hmm. Yeah, they were. Well, and from what I understand, they had been in the process of revising their guidelines for quite some time. And it wasn't until after the story broke, after everything came out, that they officially updated their policies and procedures. we had a hard time even finding out for sure what policies and procedures they were following and applying during this situation, and which led to further questions about how the whole thing was handled.
I want to go back to Dr. Fitzsimons, who's on the phone. In response to Dr. Mackey commenting how COVID-19 also presents opportunities, can you comment on the opportunity or benefit of framing mental health and supports as public health issue, given all of our heightened awareness of public health? So is there a bright silver lining in here anywhere?
Well, I'm reluctant to say that there's a bright silver lining, only because this is an incredible event that is going to be with us for a long time, apparently, in many ways. That said, I think that the quick conversion, the use of teletechnology across multiple systems, be it education, healthcare, behavioral health, communicating with your family members, that we immediately found out that we could, in fact, do this. We could use this, we collectively. And so some of the fear, the confusion, the challenges that we felt as maybe a general public toward the use of this kind of technology, it was almost immediately stripped away. And so now, whereas, as recent as 6 or 8 weeks ago, many of us would not have used this, or we barely used this type of communication form, we use it almost on a daily basis now. Mm. If there's a silver lining, I think that's where it may exist.
So, Nikki, that brings me back to you. Is there a leveling going on? I mean, rural America was depressed before this happened. Now the rest of America is experiencing intense economic hardship, with what I think the latest was 30 million Americans filing for unemployment. Rural America experienced, some degree of isolation, perhaps, voluntary and normal, but now the rest of America is experiencing, high degrees of isolation. Rural America experienced the fact that you, couldn't get to see a doctor or whatever unless you had telemedicine. Now everybody else in America is waiting, in line for that, Zoom call or some sort of, online connection with a mental health provider. Are we, in some perverse way, is this going to kind of level the playing field, or does that sound unfair to you?
I wish that it would in some way level the playing field, but what Susan started with about there's antagonism now. This has actually increased the rural-urban divide, at least in our state. I don't know about everywhere else, but there's even more of a sense that rural America, and we're technically a frontier county, social distancing is part of our life. I mean, and has been for a long time. I think there's a sense now that there's even less comprehension of where we live, what we experience, what kind of lives we lead in rural America than there was before. So there's definitely a perception here that it's all about the urban environment and the people in the city, and what's happening there isn't what's happening here. So it has really increased the level of division that we were seeing before.
Mm-hmm. Susan, do you want to comment on that? I assume you agree from your perspective, but you've been reporting it. For those who joined the call late, Susan's been reporting in rural Colorado, but she lives in Denver, so we're getting a little bit of both perspective there.
Right. Comment on the divide?
Yeah, the divide. Both in healthcare, not just in healthcare, but also in the perception of fairness and justice and humanitarian kind of caring that's going on now.
Yeah, I mean, all the nanny state allegations that the rural areas made against big cities have, and don't kill the messenger here, I'm just repeating what people are telling me, but have really heightened because they see this as a massive overreaction to something that, I mean, a lot of people in rural America, and I don't think it's just in rural America, but I will say this, think this is like the flu, and they've become very fluent in the statistics about how many people die of flu each year versus coronavirus, et cetera. I mean, that there's almost an aggressive denial about the way that this is being handled, and politicization of it that feels really palpable. And again, I've been covering Colorado for 20-something years. This is a state that has regions where that have wanted to secede from the rest of the state, and I actually expect that type of movement will be heightened given coronavirus and this political year. The fact that so much is at stake nationally. I also want to just add this. Has nothing to do with the divide, but I have someone I know, who's sort of a friend, committed suicide last week here in the city. And, and this is a person who belongs to a community that you would think is very sort of well-versed in mental health, and in which sort of stigmas, and sorry, Miss Fitzsimmons, Dr. Fitzsimmons, I don't mean to use that word to your offense, but where you would think that there would be a sort of more open conversation about this, right? And I understand that there's a big need for privacy around suicide, but it strikes me how much silence there is around this, and how a community that might otherwise take something that happened among us as a sort of teachable moment, this has just been completely closed. And the funeral, like funerals everywhere, is limited to, I think, 10 people. And so there's so much happening out there that I think we normally might hear about, but because, with prisoners, for example, we can't be in any contact with prisoners because they're all in lockdown, and despite promises from Colorado's Department of Corrections that they would be more in communication rather than less, it turns out that the prisons that have COVID in our state have not been able to access phone conversation. And so I think what we're really seeing here is it's not just a rural-urban divide, but it's this quarantine, this isolation, this separation has created the flow of information and the flow of actually, the ability for lack of a better word, sort of understanding or enlightenment has really impeded that process. And I worry about that. There's a lot more divides going on than just urban and rural. I have a prison near my home that I feel is, it may as well be in another planet because we can't get any information out of it.
Okay, just to touch on two of the issues that you just spoke about, the first being suicide. For those on the call, either journalists or mental health providers or stakeholders, we did run a program last week on suicide prevention, including what is known and not known about the statistics of suicide during pandemics, and some advice, including about this sort of separation and disparities issue from one of the experts on that panel. That everything from that session, including the video, the speaker slides, and resources for journalists if you're working on a story involving suicide, all of that is available on our website, www.nationalpress.org, under suicide. Then back to the access issue, because this comes back to the problems that you and Nikki, that you had in reporting this story. I would note that yesterday was World Press Freedom Day, a day that is more often marked by the absence of progress on things like journalists in jail than on the celebration of actual freedom as it should be. Let's go back to this issue of being the ability to report on prisons. And in fact, I believe there was a riot in a juvenile detention facility where COVID is spreading. and there's issues not just of journalist access, but also of access to mental health treatment for people who are detained, whether it's in prison or jail or ICE incarceration centers, and the ability for them not just to access the press, but also to access any kind of mental health services at a time of really extreme stress and anxiety for many. Nikki, do you want to take any piece of that? I want to give you a chance to comment on the press freedom issues from where you sit, and then we can talk about the public health aspects as well.
I don't know how it is in other areas, other rural areas, but I think part of what we encountered here is we don't have a lot of stories like this, and there hasn't been a lot of reporting that has required a deep dive into public records and background information and body cam videos and autopsy reports. I mean, we just don't have a lot of that. So to a degree, I think that came as a surprise to our local law enforcement and town officials. I think they weren't expecting that. And I don't know that they received the best guidance and advice as far as how to interact with the press, how to deal with the press from their attorneys. And that, I think that was part of the problem. For other rural journalists out there, just keep digging, keep hammering away.
Okay, always very good advice. Some other questions about, for you coming in, Nikki and Susan, how has social distancing changed how you write or edit about your community? And how do you take care of yourself during this time?
It sucks. This just sucks so much. You know, especially around mental health issues, right? I did an interview this weekend where I actually went out and stood about 20 feet away from the person I was interviewing, just because I'm so sick of doing it on the phone or on Zoom. Nothing replaces being there. You know, all the bells and whistles of technology don't hold a candle to sort of basic shoe leather journalism and being there safely. But it means a lot to people in rural Colorado when you come visit, right? Or you come speak to them. On the self-care issue, there isn't a lot of it, and I'll be honest. On Friday, what were we, like 6 weeks into this nightmare? And I snapped, kind of. I snapped at a couple colleagues, and I realized I was burned out because from a news perspective, it sort of doesn't stop. This is the biggest story in many ways of our lifetimes. And there's a feeling of real powerlessness about it because, again, there's nothing like being there. I've been writing about a friend who has been in the ICU for about 7 or 8 weeks right now. And you know, all my reporting is like through the phone, or, you know, even with the doctors, they're so busy, you can't get them on the phone to do an interview, even if you have HIPAA waivers. And so really my reporting is based on his wife, my friend's wife, tape records her phone conversations with the doctors. And that's like the extent of what I can hear from them. I mean, it's terribly frustrating. So on self-care, don't do what I do it what I say, which is take some weekends and off your screens. And it's really unusual. I'm not just a reporter, I'm an editor of a news publication. I guess my advice to all of us, including our readers, is stop reading the news. And I hate saying that, it's bad for business, but it really is, you know, my screen addiction has been way up and my sleep has been way down, and I'm sure I am not alone here. And so I encourage everybody, get off your screens.
Okay, well, our next question comes from someone who I think has a professional interest in disagreeing with you, Susan. John Quain, New York Times, will take your question online.
All right. Yeah, I split my time between the center of the pandemic and then the rural place where there hasn't been any cases at all. And I've watched different mental health issues be treated differently in cases like this. Fortunately, no fatality involved. And I just wondered if there was any studies that you guys had run across the difference between how this is handled in an urban environment or a metropolitan environment where you have a person like this and a rural one. I've seen both transpire, and I wondered if there was some sorts of information about that.
Yeah. Nikki, you want me to take that?
Yeah.
Well, so in our story, we reported that the lieutenant who killed Mr. Pierce, who actually is a very good cop and a veteran, he's been doing this for 30-something years. I think the extent of his mental health training was something called mental health first aid, which is a kind of training that is sort of meant and designed. Half the day is about recognizing problems in yourself, and then half the day is sort of recognizing stuff in other people. But this is the kind of training that librarians or anybody, right? It has nothing to do in particular with law enforcement. And that literally was the extent of his mental health training. That's appalling. I would like to say that's just a rural problem, but it's not. I think that, cities do a little bit better and they're a little bit more sophisticated about this just because they're probably dealing with it more. But I think there are plenty of urban areas that are really terrible about training on this. And, I think what we're seeing around the country, and I think this started in Miami, are these teams of police, paramedics, and sort of a mental health professional going out to incidents and to scenes where they know there's a mental health issue. I think those really work tremendously well, but they're not that funded. And the scary thing about this time that we're living in is there are no tax revenues going, right? This is not a time when you can beef up your mental health services. This is actually what we've seen historically, and this is what drives me, I was going to say crazy, but that's probably not a good word to say on this phone call, is that all of these services have always historically been the first services cut, and they probably will be the first services cut in this situation. And when I spent all last week talking to state officials and people at NGOs who specialize in mental health, and they weren't that hopeful about the kind of massive change that everybody's talking about. And they weren't that hopeful, before this happened. And the head of our Mental Health Colorado, an NGO here, really said, I think people are going to have to rely on their sort of cultural and community rituals, right? The things that communities, religions, various groups of people do to deal with grief or support each other. I mean, you're hearing the head guy who works on mental health outside of the government in the state saying that's a little scary. And I think it's probably very true.
Let me pivot over to Dr. Mackey for a minute. For those joining the call late, Dr. Mackey is also a former law enforcement officer himself before he became a professor of social work. Do you want to comment on the issue of training for law enforcement officers? I mean, they are the first responders. We've seen that before, and we don't think it's going to change, right? And at the same time, there's less and less money, as Susan points out. What's your view about what's to be done on that?
Well, first of all, I want to make note that I have not been a law enforcement officer for a very long time. So the current state of law enforcement training within behavioral health is be a little different. That said, it's also something that has become more important over time, and more agencies have adopted. There's more trainings available. There's more opportunities, and I would like to think that more response at the law enforcement level But we know that law enforcement are nearly always the first responders in crisis, regardless of the crisis, whether it be an auto accident or a behavioral health crisis. And so it only stands to reason that, what Susan is saying and what Nikki's saying is absolutely right, that these are probably where the cuts will happen. Perhaps we should rethink that, that these are the areas where there are certain known properties. Law enforcement, EMS are almost always the first responders to this. And so giving them the tools, providing them with the training opportunities necessary, and making that available. You're absolutely right, Susan. How that is going to get paid for is ultimately really the question. I don't get the impression that law enforcement is pushing back and not wanting to do this. I think that they're often just caught in a resource